Hello everyone and welcome back. In this video, I want to talk to you about AI and mental health care. So there's an article, I'll put a link to it in the description for the video, but it says AI and mental health care, what we know, what we don't, and what comes next. And this really caught my eye because there's been a couple of stories just lately of young people, young adults who went to ChatGPT and started asking for, therapeutic advice, counseling. And I think at least one of them went and took his own life. And just heartbreaking to read that story, to think that this young man went to a chatbot, which is basically a piece of software, because he was having issues and he didn't have anybody to turn to, or didn't think that he had somebody to turn to. So here it is. Artificial intelligence is becoming increasingly present in mental health care. I guess there's an academy, whatever the academy is. The academy started working on AI in mental health care in fall 2023, discussing various hypotheticals. And I guess the academy is the American Association for the Advancement of Science. It says here, clinicians began exploring AI to assist with screening, triage, and the work that happens between therapy sessions. Members of the public turned in growing numbers to general purpose systems such as ChatGPT for support in moments when traditional care felt out of reach. First of all, ChatGPT is, free. So, if you can get something for free, why not? And I'm not suggesting you shouldn't do something for free. I'm just saying, that's attractive if it obviously doesn't cost anything, and you don't have to find out if it complies with your insurance requirements and all those kinds of things. And it says here, the Academy's new publication approaches this nuanced topic by mapping the terrain rather than offering a single conclusion, expounding on the core questions that must anchor any serious debate. How should effectiveness be measured when interventions may take different forms across different populations? When should a human clinician be involved, and what kinds of oversight are necessary? How might these systems affect privacy, trust, and the experience of care? What are the implications for children, for people with severe mental illness, and for communities that already face inequities in access and treatment? And I've talked about this before. Great treatment's not available to everybody. It simply isn't. And I know there's been some talk. Apparently, the government is going to provide significant financial resources for folks to get access to treatment. And I'm always a little dubious when I hear that, not because it's not well-intentioned, but because we've seen it in the news, right? The government gets involved in giving out money, and the next thing you know, it's all getting stolen. And the people that really need it and need help don't get it. And so I'm always a little dubious, but okay, let's see what happens. Hopefully, we hope for the best. Look, I'll let you read this article for yourself. It's pretty self-explanatory, but I think this is interesting. Look, right now, as we sit here, there's just no substitute for going to speak to an experienced clinician, right? And when I say experienced, I mean someone who's got years in the field, extensive training, dealing with the specific clinical issue that you are going to talk to that person about. And I've even sort of joked with some of my colleagues in the legal profession that I think that AI is going to play an increasingly, important role in the legal profession, right? I think, it can answer the phone for you. It can draft pleadings. It can talk to clients. But you know what? I've been a lawyer 32 years now. My wife is 34. And you add in our associates, and we have about 100 years of legal experience, in various fields that I like to think make us, the best in what we do. And I don't care how good AI gets. I'm sorry, but you just can't replace that. You just can't. If you've ever called your bank or a financial institution and you get stuck with that phone tree that seems to know what you're saying, but there's just a certain disconnect, right? There's a certain coldness, a lack of emotion. Now, maybe that'll change with AI. I'm sure at some point it will, but we're not there yet. But an interesting article. I think that, it just sort of begs the question, we need to be aware and alert to, times when our loved ones are suffering and be available for them. And look, if you're a family out there and you have a loved one who's dealing with a behavioral health issue, please reach out to us. Let's talk about what options may or may not be available to you. And if you have any comments or questions, or if you agree with me or you disagree with me, as long as it's respectful, I want to interact with you. I'm interested to hear what you have to say. And if there's an issue that your family's facing, please post it in the comments. I'll make a video for you, because if it's affecting your family, it's probably affecting somebody else's, and I want you to get the information that you need. If you like this content, please give me a thumbs up. And if you want more of this content, which I put out every day, please subscribe to the channel. And with that said, thank you for tuning in. I'll see you in the next video. Bye-bye.